the last time you were here, a couple times back, you explained that there's two ways that the budget for 2013 and 14 will be presented. Can you bring the audience up to speed on that?
A couple of days ago, I had a chance to sit down with our board chair, Michael Cornell, and talked a little bit about how the budget was formed, what we're doing differently about this budget with the videos. And I think we have an opportunity to show a couple of videos here to get people more of a flavor of what we've done.
All right. Let's take a look at that right now.
I just wanted to talk to you a little bit about today, about the budget format and how we're going to try to do some things differently. Maybe build it on some different platforms than we have in the past.
Okay. How would those platforms be different from what we've seen in the past?
I think a lot of times when you see the budget documents have always been about that thick. They've been basically a book of numbers, and it's difficult for people to kind of follow the rationale of what it is we're really focusing on. So we've tried to set this up on the three platforms of sustainability, but we're adding one because of the things we do and how we do them. And those platforms would be economic, environmental, relational, and societal. And try to get people a better idea of basically what it is what we do and what they get in return for value of their investment in the annual charge and other programs.
Right, and I think that value is important because not everybody sees the value of the dollars that they're paying in.
Right.
They see it more as a tax, and I know we've talked about trying to turn that around so that people see it more as an investment.
Mm-hmm. Well, we're doing actually 2 volumes of the budget this year. That's volume 2. Again, that's for the people that want to get in and grind the details and look at every number that we have in line item. But the first is going to be a budget planning element that shows basically how we invest the annual charge dollar, how we invest the package plan proceeds, memberships, other fees, those kinds of things. And we're trying to do it a little bit more visual than we have in the past.
And by visual, you mean?
I mean, we're going to do some actual video clips that will show the budget and will show people that work for CA, how they fit into the organization. And the kind of the high point of this is that some people don't even work in the areas where they're going to be videoing, but instead are learning more about the organization as we go along.
So what I'm hearing is that this part of the budget, as opposed to the thick book of numbers, is more of a high-level overview of what the budget is doing.
Right. It's actually showing what value we provide for, in some cases, life, and in some other cases, property.
It sounds like that'll make the budget more accessible to people without having to grind down through the numbers, as you put it, and then creating a higher-level overview of how this links to the mission of the organization.
Absolutely. And we'd like to just finish this segment by showing one of the video clips. We have 18 of them in the budget, and I think they try to average between 2 and 3 minutes per video, but I think it's going to be kind of interesting as to how people can start out looking at the budget and how it might make more sense and more meaning to them.
You know you're supposed to eat right and be physically active in order to stay healthy. So why are we still losing the battle against obesity? The obesity rates in the U.S., especially for children, are staggering. What can our area do about it? Fix the problem. Hi, I'm Shani Paraska, Columbia Association's Director of Community Health Sustainability. The Columbia Association, CA, is committed to improving the health of our community. Under the guidance of our Medical Advisory Board, CA developed new youth physician referral programs that focus on exercise, nutrition, and behavioral health. The Pioneer program, Fit Beginnings, offers those who have exercised, haven't exercised in a while, or who have completed physical therapy an introduction to fitness. Fitness specialists work with participants in small groups to ensure each one learns how to safely and effectively use exercise equipment. A nutrition counselor guides each person toward positive nutritional changes. Participants can also enjoy physical and recreational activities, including swimming and yoga. Jacqueline Chavarini has been working with Columbia Optimal Health participants. This physician referral program was developed for those who face serious health risks based on unhealthy patterns. Participants meet weekly with a lifestyle coach, a nutrition counselor, and a personal trainer. Step-by-step changes are made to increase physical activity and improve food choices. With professional guidance, each person develops an individual health plan which is realistic and effective. Jackie.
Hey, Shawnee. Optimal Health brings clients to the Columbia Gym who typically are intimidated by the gym environment. So my job as their trainer is to guide them through a safe program and make it fun for them so they can see that exercise is actually a great thing to embrace as a lifestyle. And then they can come on their own eventually. Sometimes they meet people in the group, they form small group sessions, and they can keep up the programs.
Thanks, Jackie. Both Fit Beginnings and Columbia Optimal Health were developed for older teens and adults. But today's youth face diabetes and other debilitating conditions at an alarming rate. CA is currently designing a medical fitness program for children to help families have fun while learning to create a lifetime of healthy choices. For further information about new U physician referral programs, please call me, Shawnee Paraska, Director of Community Health Sustainability, at 410-715-3128, or visit our website, columbiaassociationnewU.org.
Okay, that was a lot more entertaining than reading a budget document.
Yes, it is.
Yeah, I think it's going to be a big hit with the residents.
I hope so.
Well, thanks for sharing the videos, Phil. We'll see you next month.
Very good.